Hello, my name is Hannah Todorovich, and for my presentation, I will be discussing human rights in healthcare. Without further ado, let's begin. So let's talk about the basics. What are people's rights when it comes to healthcare? Well, according to the World Health Organization, the right to health must be enjoyed without discrimination on the grounds of race, age, ethnicity, or any other status. Non-discrimination and equality requires states to take steps to redress any discriminatory law, practice, or policy. Furthermore, the right to healthcare includes the right to control one's health and body, sexual and reproductive rights, and to be free from interference from non-consensual medical treatment and/or experimentation. The right to a system of health protection that gives everyone an equal opportunity to enjoy the highest attainable level of health is also included in their definition. Now, violations in these rights can have serious health complications. In this presentation, I will discuss the Affordable Care Act, reproductive rights in the form of attaining contraception such as birth control pills, employers in the Affordable Care Act, and finally, the danger of for-profit healthcare in the United States. These topics all affect women, LGBTQ plus folks, disabled peoples, and communities of color. The 2010 Patient Protection and Affordable Care Act has expanded women's access to contraception in several ways. The Affordable Care Act requires healthcare insurers to cover contraceptive counseling and services and requires that all FDA-approved contraceptive methods are available without any out-of-pocket costs to patients. This is really great news to women around the country, especially women in lower-income households who struggle to afford birth control. And a little fun fact. The average cost of a year's supply of birth control pills is equivalent to 51 hours work for a woman making the federal minimum wage of $7.25 per hour, according to the Guttmacher Incentive. The Affordable Care Act has also increased the number of women who have access to health care by offering insurance to many women who are considered low income or who may not be eligible for employer-offered insurance plans. The Affordable Care Act also created new rules and guidelines for private insurances, including prohibiting private insurance companies from discriminating on the basis of health status, meaning they could not turn people away or charge higher premiums due to pre-existing conditions. Private insurance companies also had to allow children up to age 26 coverage under their parents' insurance. And between 2008 and 2014, the percentage of women aged 18 to 24 without health insurance decreased from 24.9 to 15.9%. During this time period as well, uninsurance rates for women of all ages dropped about 18% from 13.0% in 2008 to 10.6% in the first 9 months of 2014. In the beginning of the summer of 2014, the U.S. Supreme Court ruled to allow certain employers to block their employees' access to birth control. Now, I'm sure I'm not the only one thinking that people shouldn't have to get their boss's permission for birth control. Sadly, this rule applies to companies where 5 or less people own or co-own the business. You may have seen this in the news a few years back when it was a hot topic. Hobby Lobby and the company called Conestoga Wood were the two companies in this trial. Hobby Lobby and Conestoga rejected health insurance plans that included birth control access, stating that it violated their religious beliefs. And now recently, a few colleges and universities have also sought to take away contraceptive rights to their students. In 2014, the same year as this trial, the Obama administration rushed to close the loophole, which could allow many other employers from squashing their employees' rights to contraception. However, this did not last very long. In July of this year, 2020, the U.S. Supreme Court endorsed a Trump administration regulation that essentially allows employers with religious or moral obligations to limit their employees' access to birth control, which was ruled in a 7-2 decision. This decision from the Supreme Court put hundreds of thousands of women out from being able to obtain birth control through their employers. If women work full-time, they do not qualify for Medicaid. This ruling violates reproductive rights. If women do not have access to birth control, they're either They either have to remain abstinent or they're forced to have unwanted pregnancies. The American Care Act has resulted in some significant gains for the LGBTQ plus community, such as protections for people with pre-existing conditions and non-discrimination protections on the basis of sexual orientation and gender identity. As of 2020, 18% of LGBTQ folks have insurance through Medicaid or MA. 28% of those people report that their partner or child have received some help from Medicaid. The Trump administration is making a last-ditch effort to repeal the Affordable Care Act. Repeal of the Affordable Care Act will have devastating effects on the LGBTQ community, disabled folks, and communities of color. And the recent and rushed appointing of Judge Amy Coney Barrett is jeopardizing the access of healthcare to millions of Americans and those with pre-existing conditions. For-profit healthcare. For-profit healthcare basically means from profession to business. That is a widely used term to describe the issue where healthcare in America is being transformed from a strict professional business to a for-money business. Their decision-making techniques are very similar to those of corporations. For-profits make it harder for Americans to gain access to healthcare because some can straight up decline care to uninsured patients, and for folks insured with state insurance who may have a difficult time finding certain providers that accept their insurance in general. Certain insurances don't pay as much as others. So if a patient has MA Medicaid and wants to be treated at a for-profit urgent care, for instance, the for-profit business can turn them away. Medicaid does not pay as much as private insurance does. An example that's close to home is dentists in Minnesota don't accept Medicaid. Simple cavities can turn into abscesses, which warrant a trip to the ER to get antibiotics. However, these people usually have to wait more than a year to see a dentist that actually accepts state insurance. As far as hospital visits go, luckily in Minnesota, it is illegal to turn a patient away regardless of if that person is uninsured or not. However, in some states, they can turn patients away if they are stable enough to walk out the door, or if they're not stable enough, they will stabilize those patients and they will transfer them to a less nice, for lack of a better word, hospital. I know in Florida they do this. So basically, if you're poor and can't afford insurance, well, too bad, so sad. Either you foot the bill, go bankrupt, or you simply die, which is terrible. Now you may be thinking, how is this even fair? Why can't everyone have access to the same appropriate healthcare? Well, let's take a look at how life might be different for America, especially women of color, and LGBTQ folk, if we had equal and affordable healthcare for all. Currently in the United States, access to healthcare varies depending on race, ethnicity, location, age, socioeconomic status, sex, and disability. According to healthypeople.gov, barriers that folks face when they have no or inadequate health insurance includes unmet health needs, delays in receiving appropriate care, which potentially could be fatal, inability to get preventative services, large medical bills and debt, and preventable hospitalizations. Having health insurance helps patients get the care they need when they need it. If there was equal access to healthcare services for all, patients would receive care without fear of long wait times, a hefty bill, or discrimination. So universal healthcare would potentially provide appropriate healthcare for everyone, not just for people who can afford it. It would also grant women the right to actually be in charge of their reproductive health and well-being. Disabled people would be able to get the care they need without being told by insurance companies that they're too sick already and thus too expensive. People of color would be able to seek treatment that they deserve, whether that be for reproductive health and education or basic human needs. Healthy people equals happy people. The disparities people face when it comes to receiving healthcare is something that I'm very passionate about. I have witnessed firsthand how Black folks and people in the LGBTQ community have been discriminated against when they are seeking medical treatment, and it is something I will not tolerate when I become a healthcare professional. So, thank you so much for watching my presentation. If you're interested in some of the sources I use for research, please feel free to look at my works cited, which is to follow.